Widespread dull pain, skin sensitivity, headaches, fatigue, brain fog. This is the reality of fibromyalgia. I'm Dr. Michael Kaye from the Center for Functional Health, and today I want to talk about some herbs and supplements that may help fibromyalgia and talk a little bit about the importance of exercise and nutritional profile and nutritional protocol. All right, so let's jump in. So many patients who suffer with fibromyalgia face barriers trying to relieve their symptoms through conventional medicine, but there's many supportive things that you can do that can help you, and these natural options can help ease some of the pain. When you have fibromyalgia and you see your primary care doc or the conventional medical system, the thing that they normally do is just throw medication at it. And sometimes medication is needed, and that's okay. It's not always a bad thing. The idea, though, is if we can control and or manage some of the pain, especially the fibromyalgia flares, through using nutritional supplements and herbs, that's a great place to start. So some of the herbs and supplements that I like to use is magnesium citrate, omega-3, fish oil, curcumin, which comes from turmeric, and all of that can help to bring down that inflammation, and especially muscle tension. Some of the other things I like to use at time is valerian root. So valerian root may sound familiar to you because the medicine Valium actually comes from that plant, valerian root. And valerian root helps to calm the muscles as well as magnesium. Now, the other important aspect to look at is actually it's not a vitamin. We all call it a vitamin, but it's a hormone, and that's vitamin D. So, vitamin D is really important because studies show that individuals with vitamin D have a low level of vitamin D has an increased likelihood of reporting pain associated with fibromyalgia. So, what's considered a low level or a high level? Let's talk about that a little bit. The reference range for vitamin D is 30 to 100 nanograms per milliliter. So, if your conventional doctor runs the vitamin D and they say, well, it's 32, so you're fine. Well, the problem is you're not fine. It's surely not at optimum. When we want optimum vitamin D, we're looking between levels of 40 to 60 nanograms per milliliter. Now, we surely don't want 100 because that's not good either, because that's the other end of the spectrum. And we want to be cognizant of that because vitamin D is a fat soluble vitamin like A, D, E, and K. And we don't want it to be too much in the body because then it can store in the liver. So a good reference range for vitamin D is between 40 to 60 nanograms per milliliter. If you're at 30 and you're in my office, I'm going to tell you that you're too low. And if you're already taking vitamin D and you have a vitamin D test and it's still showing low, that means you're not absorbing what you're taking. So you have to move to a different source of vitamin D and or add in other sources. Now, if I see a vitamin D level that's 20 or 13, I've seen as low as 8. So at that point in time, we want to move to conventional medicine because they have to actually write you a prescription for like 50,000 IUs, which is international units for vitamin D. So vitamin D is really super important, especially if you suffer with fibromyalgia. So another great source of getting vitamin D is get out into the sun. And that's really where vitamin D is converted in our body, is getting out in the sun. So if you live back east like I do, the sun isn't always present. So you have to consider taking vitamin D, but you want to consider getting that blood test first. How much vitamin D do you actually need? That's the difference between recommending somebody 1,000 IUs, again, international units, 2,500 IUs, 5,000 or 10,000 IUs. Now, with my vitamin D, I take vitamin D and K2 at the same time. Again, another fat soluble vitamin, which is important for the uptake in calcium. So now let's talk about fibromyalgia and sleep or lack thereof. Often my patients who suffer with fibromyalgia have difficulties falling asleep. So this is where I really want to work on getting good quality sleep, because if we get good quality sleep, that's where you can repair and that's where you can recuperate. So I'll use products like melatonin, ginseng, 5-HTP, valerian root again, and magnesium. All these type of supplements help calm down the muscles, calm down the pain, the flare of fibromyalgia, just so my patient can get some good sleep to start the repair process. So now let's talk about exercise and fibromyalgia. Often you'll hear, well, you just need to go and exercise. Well, you know what? When you're in a ton of pain and you hurt all over, that's the last thing that you feel like doing. And when you have a fibromyalgia flare, you don't exercise out of that fibromyalgia flare. And I know we see on the internet and we speak to often doctors and families and friends like, well, you just need to exercise. And again, I'm sure most of you who suffer with fibromyalgia, obviously you get the concept you need to exercise, but it hurts to move when you're in a lot of pain. I try to explain that to the relatives of those who come in with their significant others or their moms, their dads, their sons or daughters that they suffer with fibromyalgia. Because fibromyalgia, it's like wearing like a wetsuit, so everything is tight and restricted, and carrying a rucksack in the back of you and a rucksack in the front of you, and they're all different weights, and it's like you're trudging through quicksand and water all day long with all this on you. That's the best way to explain fibromyalgia. On top of that, you hurt. So yes, movement is important, but we want to talk about when to move and how to move. And we know that movement's important because it lowers body weight, it lowers inflammation, it's great for your overall physical and mental well-being. But again, you want to be able to understand when to move and how to move and in what setting. So again, when you have these aches and pains, it's hard to move on a daily basis. So some of the things that we want to do is really consider walking, because we know that walking is a great thing to do. And when it comes to movement, we want to think about gentle movements. So we don't want you taking a high intensity interval training class. We want you to think stuff like yoga, tai chi, qigong. All these type of movements have been found to be very helpful. And also walking, like we said before, and any exercise you can do in water. Okay, so now next thing we'll talk about is strength training. So strength training is really important. And I know what you may be thinking. If you suffer with fibromyalgia, or if you know somebody who suffers with fibromyalgia, how the heck do we do strength training when we can't even move properly? And that's where you have to look to a professional. That's one of the things we work on in the office, is helping people incorporate strength training. And that could be just your own body weight. It doesn't mean that you're throwing weights over your head. So strength training, proper strength training, is really important. And you don't want to push yourself. The whole idea is that you want to be able to exercise, not hurt, so you can come back the next day and exercise, because consistency is what matters most. So you want to be consistent with your type of exercises. Maybe one day the exercise is focused on stretching, one day the exercise is focused on core, one day is focused on balance, one day is focused on strengthening. You just don't want to beat yourself up so much that you can't come back. So exercise is great to do, but finding the right exercise is what's important. So I developed what's called a 5-to-1 series, and you can find that on my YouTube channel. And I choose 5 exercises that we do for 5 reps, 4 reps, 3 reps, 2 reps, then 1 rep. At the end of that, you can decide how you feel. If you feel good, meaning you're not hurting, you can do another round of that. And again, the exercise program is set up to where you can move and assess. And that's the whole idea of doing 5-to-1. So you do the series of 5 repetitions down to 1 repetitions, assess how you feel. If you feel good, you can do another round of that. Now, this might be focused on one movement, or it might be focused on 5 different movements. So we talked a little bit about herbs and supplements, and then we talked about exercise. And now I want to talk about something that is often overlooked when managing fibromyalgia, and that is nutrition. So food is medicine, medicine is food. And I like to, for my patients who suffer with fibromyalgia, I like to give them a anti-inflammatory protocol diet. And one of the anti-inflammatory protocol diets I use is called a low FODMAP. So FODMAPs, FODMAPS, that stands for fermentable, oligosaccharide, disaccharide, monosaccharide, and polyols. These are fermentable carbohydrates that are in the diet that can contribute to inflammation. Now, high FODMAPs are wheat, onions, garlic, beans, many fruits, including apples, figs, peaches, nectarine, vegetables that we hear are healthy, but they still has a high FODMAP: asparagus, Brussels sprouts, cauliflower, and then sweeteners and dairy products. So I can share with you that a lot of my patients who I see with gut issues, with autoimmune issues, with widespread muscle and joint pain, with fibromyalgia, with myofascial pain, I really ask them to cease eating sweeteners and dairy products, right? So we eliminate that from their diet. And the nice thing is they feel better when doing that. So when you try to follow a FODMAP diet, keep in mind that it is very strict, it's restrictive, but it's not forever. The idea is that you want to be able to use a nutritional protocol to squelch the inflammation. So, for example, if you have an infection, you get an antibiotic, and that antibiotic could be 7 days, 10 days, 2 weeks, but you're doing that to get rid of that infection. And this way, we're using the nutritional protocol as a way to squelch the fire, the inflammation. That's what we want to do. Now, when doing again a low FODMAP, what's most important when you do an elimination diet or a FODMAP diet is how you reintroduce food back into your diet, into what you're eating, because we want to see what's aggravating, what's not aggravating you. For example, when I have patients that suffer with widespread joint pain, I often have them remove nightshades. So nightshades are eggplants, potatoes, tomatoes, and peppers. When they remove that and they say they feel better, there's less joint pain, then we say, great. And now we're going to add those products, those foods back in one at a time to see how you respond. And if we find one that really aggravates you, then we just eliminate it altogether. All right, so that's it for today's discussion on fibromyalgia. So again, certain vitamins, supplements, herbs that can be used, getting the right type of exercise for you based upon your presentation, and then using nutrition as a protocol to squelch the fibromyalgia flares. So if you need help, please let me know. And thanks for watching. Once again, this is Dr. Michael Kaye from the Center for Functional Health. Have a great day.